So, Chapter 2 introduced you to cells of the nervous system, and Chapter 3 went on to describe its basic structure. Now it's time to build on this information by introducing the field of psychopharmacology. Now, psychopharmacology is the study of the effects of drugs on the nervous system and your behaviors. This week's lesson discusses the field of psychopharmacology and descriptions of pharmacokinetics, drug effectiveness, placebos, and the effect of repeatedly taking drugs over time. The word drug has several different meanings. In one context, it refers to the medication you would obtain from a pharmacist, a chemical that has therapeutic effect on the disease or its symptoms. In another context, the word refers to a chemical that people are likely to abuse, such as heroin or cocaine. Through this lesson, we're going to explore psychopharmacology and the various drugs that have an effect on the brain. So let's start off by defining what a drug is. A drug, by definition, is an exogenous chemical that is not necessary for normal cellular functioning, and it significantly alters the function of certain cells of the body when it's taken in relatively low doses. Now, drug effects are the changes that we can observe in the individual's physiological process and behaviors. The site of action is the points at which the molecules of the drug interact with molecules located on or in the cells of the body, thus affecting some of the biochemical processes of these cells. Pharmacokinetics, which is sometimes described as what the body does to a drug, refers to the movement of drug into, through, and out of the body. The time course of its absorption and bioavailability, distribution, metabolism, and excretion are also described in pharmacokinetics. So let's talk about absorption. The drug is administered and it's absorbed through the tissues, and this usually happens through intramuscular injection or ingestion through the stomach. Distribution is when the drug is distributed throughout the body and usually through the bloodstream. Metabolism, the drug is changed from an inactive form by enzymes, and that usually occurs in the liver. And then lastly, excretion, where the drug is exited through the body, or from the body, usually through the kidneys and urine. So here's a list of ways that a drug is absorbed into the body. A lot of these are some pretty big words, so I'm going to go over them briefly. Intravenous injection, IV, it's an injection of substance directly into a vein. The intraperitoneal injection, or the IP, is an injection of substance into the peritoneal cavity, which is the space that surrounds the stomach, intestines, liver, and other abdominal organs. Intramuscular injection, the injection of substance right into the muscle. Subcutaneous injection, which is injected beneath the space right beneath the skin. Oral administration, obviously through the mouth, that is the drug is swallowed. Sublingual administration is administration of substance by placing it beneath the tongue, and it's absorbed into the skin beneath the tongue. Intrarectal administration, it's a substance that's absorbed through the rectum. Inhalation, administration of vaporous substances into the lungs. Topical administration, administered right on top of the skin or the mucous membrane. Intracerebral administration, a substance that's entered directly into the brain. Intracerebroventricular administration, or ICV, administered of substance into one of the cerebral ventricles. And all of these ways, depending on how the drug is introduced into the body, could take different times and have different potencies. If this chart here shows some of those different lag times and plasma concentrate. This one specifically is for cocaine concentration. And so if you look here, intravenous is probably the shortest time with the longest potency, but it declines pretty rapidly. Whereas if it were to be intranasal, it's still a pretty quick lag time and high potency, but it lasts a little bit longer than it would be done if it was administered intravenous. And obviously, smoking and oral are other ways that it can be introduced, and you can see those lag times here as well. Once a drug is absorbed into the system, it needs a means to get to where it's going. Now, if you remember from chapter 2, how the capillaries in the brain are a little bit different, how they're a little bit tighter controlled and don't allow the free flow of blood or substances in and out of the capillaries. So this plays an important part in targeting certain areas and certain behaviors in the brain, especially with psychotropic drugs. So what we call that, the most important factor that determines the rate at which a drug is in the bloodstream and reaches the site of action within the brain is lipid solubility. Essentially, lipid solubility is the ease with which the drug molecules absorb into the fat and are carried around. The blood-brain barrier, as you remember, is the barrier that only allows for water-soluble molecules to go in and out, and that's for the brain's protection. And the molecules are soluble in lipids, and they pass through the cells and the lines in the capillaries and in the central nervous system, and that's where they rapidly distribute themselves throughout the brain. Albumin is a protein found in the blood, and that serves as a transport of sorts for free fatty acids that can bind with some lipid-soluble drugs. Obviously, drugs cannot remain in the body indefinitely. Now, some may last in the body a little bit longer than others. However, they have to be metabolized and then excreted, usually out through the urine. Many are deactivated by enzymes, and they're eventually excreted, primarily through the kidneys. But the liver plays a pretty important role, especially an active role in enzymatic deactivation of drugs, but some deactivating enzymes are also found in the blood itself. So let's talk about drug effectiveness. As you can see on this graph here, this shows drug effectiveness based on the dose of the drug and the effect of the drug. This graph shows the magnitude of the effect of the drug as a function of the amount of the drug that's administered. This is called dose-response curve, is what you're seeing here. The therapeutic index is something you'll hear referred to, which is the ratio between the dose that produces a desired effect in 50% of the animals and a dose that produces toxic effects in 50% of the animals. Quite simply, affinity occurs, which is the readiness of which two molecules join together. But what's important about this slide is to understand that increasingly stronger doses of the drug produce increasingly larger effects until the maximum effect is reached. After that point, increments in the dose do not produce any increments in the drug's effect. However, the risk of adverse side effects could occur. And on this slide, you see the dose-response curve on the left of the analgesic effect of morphine. Now, the curve on the right shows one of the drug's adverse side effects, its depressant effect on respiration, which could cause a person to stop breathing. The drug's margin of safety is reflected in the difference between the dose-response curve and its therapeutic effects for what those adverse side effects are. So when doctors prescribe, they look for something in the middle and not beyond either that left curve or that right curve. Okay, so we have a couple important words here that I think need to be associated with the effects of repeated administration. The first one is tolerance, and that's essentially the decrease in effectiveness of a drug that is administered repeatedly over time. It doesn't happen immediately, but over time, the more the drug or higher doses, the less effect will be observed. Sensitization, however, is the increase of effectiveness of a drug that is administered repeatedly. That means over time, the effects become a little bit more pronounced. And then you have withdrawal, or the appearance of symptoms opposite to those produced when the drug is administered repeatedly and then suddenly no longer taken. And we see that happen a lot with physical chemical dependence, usually in some kind of drug dependence when they're not taken or administered by prescription. So the last topic that we're going to talk about with principles of psychopharmacology is the placebo effect. A placebo is anything that seems to be real medical treatment, but it isn't. It could be a pill, a shot, or some other type of fake treatment. What all placebos have in common is they do not contain an active substance meant to affect health. Researchers use placebo during studies to help them understand what effect a new drug or some other treatment might have on a particular condition. In one study involving asthma, for example, people were using placebo inhalers, and they did no better on breathing tests than sitting and doing nothing. But when researchers asked if the people's perception of how they felt, the placebo inhaler was reported as being effective as medicine in providing relief. So how does a placebo effect work? Research on placebo effect has focused on the relationship of mind and body. One of the most common theories is that the placebo effect is due to a person's expectations. If a person expects a pill to do something, then it's possible that the body's own chemistry can cause effects similar to what the medication might have caused. And this is going to be very important, especially when we talk about experimental research design and control groups. So that's all I have for Principles of Psychopharmacology. Obviously, your book has a lot more details and what goes into all this. And of course, if you have any discussions or questions for me whatsoever, either put it in the discussion post or email me directly.